delivered through what we call talking therapies. Multisystemic therapy has the most significant chance of success. And the other unsurprising characteristic of really successful interventions was mentoring. A trusted adult that works with a vulnerable family or a child and young person, pre-birth sometimes, but then works with the family 0 to 5 years, but also works with the child. And interestingly, secondary schools, particularly in the UK, know that mentoring works because they use mentors for young people between the ages of 13 to 16 who may be vulnerable as they approach examinations at 16. So they know that mentoring works, but actually what we have found is that giving families, young children and older children, a trusted adult with whom they can work, who takes an interest in them, who can provide access to specialist services, who can often hold the ring on support, makes the most significant difference to vulnerable children, young people and adults. So what works? Families experiencing marital conflict or domestic violence often do not readily access services. So this again is where we need to make sure that support services are available at most local level, easily accessed, avoiding stigma, and again provided through universal services, through medical centres, through health services, through schools, through early years centres, where parents can, without fear, say they need support at particular moments of high stress, and often confidential support. But this is also where workforce development is key. We need to have people working in services that understand the points of stress and crisis in families' lives and who know best how to provide them with the support that they may need. Another piece of evidence we found, of course, is that teaching children at the earliest possible opportunity, from early years onwards, about how to manage relationships can be a way of offsetting difficult relationships as those children mature and grow into adulthood. And our other finding is that some of the most successful services provided for parents and carers experiencing divorce or marital conflict are those which are anonymous, where access to support and helplines can be provided through websites and other means which are anonymous, where parents have not got to identify that they may need that help. So web and media-based services can be a great help, certainly in the initial stages of experiencing stress and strain. Just very quickly, I want to look at the particular challenges facing families with disabled children. And again, we've got a whole body of research reviews that look at the needs of families with disabled children, because what we found in the UK is that a significant proportion of children with disabilities do end up either in foster care or long-term care. So we looked at 3 research reviews looking at children with disabilities, and they are listed here: improving the well-being of younger disabled children and their families and effective event intervention, helping parents and carers of children with disabilities have access to a whole range of positive activities, but also ensuring that parents and young people have access to services which meet their very different needs across the spectrum of disability, whether it be physical or learning disability. So I've been identifying some of the headline messages that have come from a number of our research reviews, but I suppose the fundamental question that we're all asking ourselves, both in the UK and I know you are too, is actually how can we do better? How can we intervene earlier at lower cost but more effectively to offset some of those more significant strains and stresses and poor outcomes as children move into adulthood or that parents and carers experience? And unsurprisingly, what we do pre-birth to 5 makes such a significant difference, both to children's lives and to those of their parents and carers. And as you know, we've pulled together Grasping the Nettle, which looks at effective early intervention. But we've also pulled together a number of research reviews which focus particularly on the years 0 to 5. And unsurprisingly, we know the risk factors, don't we? Poverty, poor early care, poor relationships with siblings and other children, illness and disability are all risk factors which emerge as soon as, if not before, a child is born. But we also know those factors which actually produce real resilience in children and young people. Maternal education, the quality of the home learning environment, high quality preschool and parental engagement in their child's development. We know the things that make the difference, and those are the things that we have really got to attend to. But it must be stressed that all parents can be good parents, and that socioeconomic disadvantage is not a block to effective parenting. So what really makes a difference through early years? Well, there are 6 things that make the difference. First, in the UK setting, it's the work of children's centres and the way that children's centres and the staff that work in them reach out to disadvantaged families at the earliest possible stage to provide them with support and encouragement in providing a high quality learning environment, but also show them ways to engage with their children, encourage speech and language development, play with their children, read with their children, and provide the best possible nourishment for their children. So high quality early years provision, where we reach out to disadvantaged families and disadvantaged communities is absolutely key. The other finding, of course, is where we bring services together through our early years settings. So through our children's centres, we have high quality health services, health visiting services, as well as education services, all provided through the same setting, all working with parents of very young children from the outset, but working together in a holistic way. The other finding, of course, is in relation to breastfeeding. And breastfeeding rates actually in the UK are not good. But all the evidence is that if we can encourage young mothers to breastfeed, and breastfeed not just for the first 2 or 3 weeks, 3 or 4 weeks of a child's life, but hopefully for the first 3 to 6 months of a child's life. Not only does that really enhance the attachment between mother and child, but the effects of breastfeeding seem to sustain children across all their outcomes as they move into school and beyond. So breastfeeding is important not only for the child, but also for the child and its relationship with their mother. And of course, the most proven intervention in relation to breastfeeding and support of parents and children 0 to 2 years is through the family nurse partnerships, where the initial work, of course, undertaken in the United States and now being rolled out across England. Family nurse partnerships where a midwife is assigned to a young mother pre-birth and stays with that young mother, supporting her as the trusted, dependable adult between the ages of 0 to 2 years. So pre-birth through to 2 years, family nurse partnerships, or a model of support that really seems to make a difference. And the evidence-based parenting programmes, effective parenting programmes do work, particularly if they're delivered through early years settings or schools. And the ones that have got a lot of evidence behind them, Triple P, and I know a number of you will smile because Triple P, of course, originated in Queensland, and I know some of you have different views about Triple P, But in the UK, we're looking at Triple P, but also the Incredible Years and Strengthening Families, Strengthening Communities, as well as others. And many of these programmes are set out in the Graham Allen Review on Early Intervention, as I mentioned before. And the last feature, in terms of effective intervention for young children, is the way that we support speech, language and communication difficulties. Because we have found that a disproportionate number of children who go into our youth offending services and end up in prisons, as well as encounter real difficulties at school and in holding down employment, are where speech and language and communication difficulties have not been addressed. 60% of young people in our youth custody services, for example, are seen to have speech and language difficulties. We know those are issues. We do know how to deal with them, but we actually don't do it particularly well in the UK. I've already talked about positive and confident practitioners and practitioner engagement with families. Really having parents, carers and children at the heart of what we do, parental engagement. Making sure that our help is actually non-judgmental and practical, and we know that it works. That we try as far as possible to have a stable relationship between service providers and service users, and that we minimise the changes to service personnel who are working directly with families experiencing stress. That above all else, there's an open and honest relationship between practitioners and families in receipt of care and support. That we do have professionals that are non-judgmental, well-trained, well-supported and empathetic. And that senior managers and leaders give those practitioners who are working with some of our most challenging families the level of support and management and encouragement that they need. And that, of course, that we do have the active engagement of young people in designing the services that are provided for them. I've talked all the way through this about successful multidisciplinary working, and just very quickly, the key characteristics, you will know what they all are, but actually what we have found, and I can't stress enough the importance of multi-agency working with families with multiple needs. These are the characteristics which are essential. Investing time to build trust between agencies if we really want to ensure that we produce a successful coordinated approach. Co-locate agencies and services where possible. And again, I've talked about through children's centres, early year settings, through schools. Share information, share data. Produce coordinated packages of action with the child, young person, family at their centre. Have a key worker, trusted adult, lead professional holding the ring between all agencies and services, working with the family, so that families are not experiencing multiple assessments and multiple appointments, multiple courses of action. A coordinated approach, lead professional, key worker holding the ring. Have a team around the child or family approach. Jointly train agencies and services together in how best to work with families, children and young people, rather than training our teachers and our social workers and our health professionals separately. Train them jointly on those things that make the difference. And interestingly, working with families with multiple difficulties, the characteristic of successful practitioners seems to be having an assertive, empathetic, persistent style, whereby you don't give up as soon as you are rebuffed or held back at the door, but you persist in working and connecting with the family with whom you're working. So thank you so much for listening to me today. I'm sorry if I've talked in headlines. I'm sure you're sitting there thinking, well, we knew all that. And I'm sure you did. But I think it's always worth reminding ourselves about those things which are important, where the evidence suggests they do work, because we need to do more of what works and less of really what doesn't.